Hey everyone, this is Derek. I just wanted to make a quick video on some basic information on back health and treatment methods. So one of the main things that I want to try to convey is there are at least 20 different categories of treatment for back health, and each one of the treatment methods can take years to become a master at. So it is your responsibility, it's your job, if you are in pain or chronic pain, to try to learn as much as you can about each treatment method, and don't just listen to one specialist. You have to try to learn as much as you can about as many different treatment methods as possible and see what actually works for you. So this is, again, going to be a quick video. I'm not going to go into depth on all the treatment methods. First starting stats that I think everybody should know, the sources are below. 80% of the population will experience back pain at some point of their lives. So if you're an adult, there's a high percent chance that you will at some point run into back pain for a decent amount of time, whether that's 1 or 2 days or a couple weeks. Low back pain is the leading cause of disability worldwide. On top of that, it's an estimated cost about $50 to $100 billion in lost productivity and other costs just for the United States. 90% of back pain cases are resolved within 6 weeks. So this is very important to understand these next 3 stats. So 90% of back pain cases are resolved within 6 weeks, which means that if you pull your back out or you get hurt and you're laying in bed and you hate life, that more than likely your back is going to naturally fix itself. The body is designed to fix itself, right? So if you pull something out, your body is designed to heal. So 60 to 80% of those occurrences have a reoccurrence within 2 years, which means that if you hurt yourself, if you're in that 90% and you hurt yourself, there's another 60 to 80% chance that you might hurt yourself again within 2 years. Again, your body's still fixing itself within that 6-week period. Now, this is probably the most important stat, or one of the most important stats. 7% of those people that injure their backs or hurt their backs develop some kind of chronic back pain. So that's something that's lasting longer. I don't know the exact definition, but it's something that's lasting longer than that 6 weeks. Most likely, chronic is for, hopefully not for the rest of your life, but chronic is multiple years. So something that is just not going away with basic treatment. There's been an increase in the number of adults experiencing back pain in the United States, which means that whether it's our diet or the fact that we're sedentary and we're sitting at work most of the day, or genetics, or whatever's happening, there's an increase in people with back pain. And again, very important, 9 out of 10 people never know the exact cause of their pain. Okay, so now that we got that out of the way, I'm just going to review some of these basic areas of expertise. So treatment. What are the specialists who are we seeing? So one form of treatment are pharmaceuticals, which most people are familiar with. So pain medications like Vicodin, Percocet, oxycodone, Oxycontin, muscle relaxers like Flexerol, nerve blockers like gabapentin, so to try to reduce the leg pain, and some physicians or pain specialists are also using antidepressants to try to help with back pain. Chiropractors is another huge field for treatment methods. These are obviously not MDs or DOs, but if they offer people some help, they have a multitude of treatment methods. But so just these 2 specialists, chiropractors, takes many years to become a chiropractor, and then to become successful at it, you need multiple years and hundreds, if not thousands, of patients to kind of learn what's useful. Same thing with the medications. Everybody has different tolerance levels or what medications work for them. And of course, there's the negative long-term side effects of use of medication for your chronic pain. Massage therapy is another one. Again, takes years to become proficient or to become a very good massage therapy. So right now we've just listed 3. We're just going to keep going off of this, but again, this is just to touch upon all of the multiple treatment methods. Physical therapy, again, years to become a successful physical therapist. They have a lot of treatment methods of core strengthening and a lot of the exercises that they do, and mobility treatment. So cold therapy. Cold therapy, we have ice packs, ice baths, and cryotherapy. And just a quick aside with this, I've probably spent, especially after the first 6 months when I wasn't getting better, I probably spent somewhere between $200 and $400 just on different types of ice packs. The best ice pack for me that I've found is just using frozen vegetables. Just make sure to put them in some kind of Ziploc bag, so if you are using them and you're in your bed or on the couch, the pack doesn't bleed over. You have ice baths, which I really like, and cryotherapy. So there's some studies that show that the ice treatment is good for anti-inflammation, but there's other therapies that say you might have a higher chance of injuring yourself if you use the ice or cold therapies and then you get into movement too quickly without warming up the muscles. Heat therapy, heating pads, hot tubs, steam rooms, and sauna. I'm a big advocate of the hot tubs. I think everybody should be using them even if you don't have back pain. It's something that can relieve stress, but I suggest trying it, and don't just go once. I was going every day, so every day for about 15-20 minutes. Again, if you are injured, whatever chronic pain you're dealing with, or whatever pain, you have to take it seriously to try to fix that pain. Acupuncture, again, another discipline that is going to take years for somebody to become proficient at. I've tried acupuncture, it didn't really work for me, but there are some people that say it's beneficial for them. Yoga or deep stretching, I have tried yoga. It was beneficial for me, but there were some times where I did go a little too frequently, and I did have a couple instances where I did feel more injured after leaving yoga. I felt the higher level of sciatic pain after yoga. So again, yoga takes years if you get a good yoga teacher, the class sizes are going to be moderate, and they're going to be giving you some specific attention, that one-on-one attention. Just make sure to tell your yoga instructor that you are dealing with an injury, and you want them to actually put their hands on you and show you or push you a little bit further than you normally would be. Again, starting classes, there's classes everywhere. I suggest you take a look at that. Electronic stimulation, this is another treatment. Most physical therapists and chiropractors have electronic stim therapy. You can actually buy your own unit online on eBay. They're anywhere from $500 to $3,000 or $4,000. Again, something I suggest. It did help me. Surgery. Now, this is one of the big ones. We have discectomy, laminectomy, and fusions. There's other multiple surgery types. There's the laser surgery, where they cut out a piece of the disc that's impeding on the nerve, minimally invasive. The fusions are obviously more invasive. But this is a big one. This is a big one in the United States. This is what a lot of doctors or a lot of hospitals are pushing for. And remember, it's up to you, it's up to your physician, but my suggestion is try the non-invasive procedures or therapies first. Try them before you jump into surgery, because once you do get surgery, you can't retract that. You can never not have undergone surgery. Stem cell treatment is a big one. There's, to the best of my knowledge, 2 different types where they're harvesting stem cells from placenta or from your own hip bone. Not covered by insurance. I've heard good and bad things from stem cell treatment for the back. This is going to cost you anywhere from $10,000 to $30,000 depending on how many treatments you get. And if it doesn't work, it doesn't work. You're not going to be getting your money back. So this is still in the middle phase of treatment. So I personally would want to wait a little bit longer to hear some more positive or negative stories, some more feedback on the treatment. But this is going to be a viable option in the future, hopefully. Homeopathic therapies, so we're talking about natural supplements, cinnamon, garlic, curcumin, turmeric, so some anti-inflammatory things. This is a hit or miss, so depending on how you respond, how your body will respond, it's up to you if you want to give it a shot. But again, this is a discipline, so homeopathic therapy of using natural substances to try to heal the body, that is a discipline that takes years, not 2 or 3 years, like 10, 20, or 30 years to become proficient at. So again, all of these different disciplines take years to become good at. Something that people are starting to have a conversation about, medicinal cannabis or medicinal marijuana, THC and CBD. Again, we would probably wait, obviously make sure it's legal in your state, but we want to see more feedback on studies to see how beneficial this is. And a lot of physicians are starting to look towards medicinal marijuana or cannabis as an alternative to those pain medications such as the Vicodin, the oxycodone, the Oxycontin, and the Percocet. And then weight loss is really a basic one that could fit in many of the other categories. So we have detox medications like phentermine or phenylmetrazine, so weight loss medications. The idea there being if you lose some weight, then there'll be less stress on your spine, so your stomach, your weak, overweight stomach is not pulling directly on your weak spine, possibly causing more disc issues or nerve issues. And then another one, again, something that would take years to become a master at, or more studies obviously need to be done as well, but some physicians are turning towards hormone therapy, testosterone replacement, HGH and HCG. So that would include going to your physician, getting a free testosterone level done to check your testosterone levels if you're a male, and see if the physician is willing to work with you on that. So I believe that's it. I just, again, wanted to make this overview of some of the treatments. These aren't even all of the treatments. There's, I'm sure, 20, 30, 40 more different types of treatments for chronic pain, especially chronic back pain. So thank you very much and have a great rest of your day. Bye.